the first thing to say is that these are not anti-epileptic drugs, they're anti-seizure drugs. In other words, they treat the symptoms of the disease, but they don't treat the cause of the disease. It's like putting elastoplast on a cut. With a bit of luck, the cut will heal, but the elastoplast doesn't heal it. And so we've known that for a long time. So as you do outcome work over the years, and we have looked at our newly diagnosed patient population over a 30-year period, and there's now 1,795 patients, and we follow them up as long as we possibly can. And if you look at the first 10 years and compare it to the second 10 years and compare it to the third 10 years, there's no difference in outcome. There's no difference in outcome in terms of efficacy, and there's no difference in outcome in terms of tolerability. And one of the reasons for that is that the epilepsy population is split into three main groups. There's about 60% of patients who will control on the first or maybe second drug at a modest dose and won't have any side effects. And so you can't show any differences between the old drugs and new drugs for that because you're not going high enough. The third group, arguably, has got refractory epilepsy. And so when you reduce the seizure numbers down, you don't ever quite make them seizure-free. And so these patients have an epilepsy that doesn't respond to the elastoplast, and so you don't see a difference in outcome. The group in the middle, about 15% relapse and remit. So at any one time they might have been seizure-free for 5 years and then develop refractory epilepsy, or arguably they might not be seizure-free and then suddenly become seizure-free. So that observation, which we've done over 30 years, explains why you can't see any difference in the different drugs. If you had to push the doses up higher, would the newer drugs be better tolerated? It's possible. But because you have to push them up to try and chase the seizures, you get to the side effects with them. So I think that explains the scenario.